Thank you for that intro, and I appreciate the opportunity to speak with you all today. Play It Health was initially founded in the adherence engagement space. I was previously a pediatric heart and transplant surgeon. We were having distinct problems with patients being able to adhere to their platforms or to adhere to their prescribed care. And we had established a complete virtual care platform that had remote patient monitoring embedded at the center, but surrounded and embedded in a very rich communication platform with rewards, education, and surveys. But our world, I would consider that our company really didn't launch until about 2018 or 19, when Medicare announced that it would reimburse for 4 CPT codes related to remote patient monitoring. This revolutionized the industry. It resulted in something where your average practitioner or an average family practice with 4 to 8 practitioners could bring in over $1 million in additional revenue. Pre-pandemic, this area had even been predicted to reach a market cap of 1.8 billion by 2026. During the pandemic, I think everybody on this call has realized just how big of a point virtual care has become, both for patient care continuity and for continuing revenues with many practices and institutions. So as a physician, as a scientist, as an immunologist, we knew we had a platform that could help with COVID, but we also knew that there were other things that we could do to make our platform more powerful. So from the beginning, we added COVID educational modules to our platform. And more recently, we've even added vaccine hesitancy modules to our platform with associated surveys and questions. We also added continuous monitoring. So not just the ability to monitor somebody's pulse oximetry once or twice a day, but the ability to do that continuously, the ability to do that with temperature continuously, and even the ability to do that with cardiac monitoring continuously. We partnered with a 24/7 nurse call center. We partnered with cultural ambassadors in underserved communities. And we essentially were able to offer that entire end-to-end remote patient monitoring platform when we even established our own patient or our own community practice. In other words, physicians that were devoted solely to remote care. That's called remote care docs. Now I'm going to share just one story from the middle of COVID that actually means a lot to us. This is a practice that went from a cold Google ad, we're talking about that kinetics of onboarding, to onboarding on February 4th after signing a contract on January 27th. We saw this coming. We wanted to get them on board as quickly as possible and get the patients on. And because we got them on so quickly, we have just harvested long-term data in the last couple of weeks of patients that have been on the platform an average of 11.5 months. And for those patients that have been on the platform, 82% of those patients are getting data transmitted every 48 hours. And 66% of them, or over 66% of them, are getting data transmitted every 24 hours. This is virtually unheard of in the industry. And this means that Planet Med has been incorporated into their care management. It also means that remote care can do all those things that we wanted it to be able to do for long-term outcomes, not just short-term outcomes. As a result, this is our sort of market approach, the channels that we have been approaching. We've definitely been focusing in the physician groups and the ACOs, but we anticipate with this kind of data, the payers are going to be much more interested in our platform. They had already been reaching out to us before this, but I think this is only going to solidify this and make this one of our sort of biggest channels. This is our traction up to this point. As you see, we have focused anywhere from the academic groups that we're doing quite a few studies with to community practices. And we have a very experienced team, every member on this team having over 25 years of experience in either healthcare or health IT. So this was the data slide that just showed the adherence. So where patients are using in the platform are using it every over 82% of the time, every 48 hours, and over 66% are using it every 24. This is our approach to the market. And as I was saying, that with that sort of long-term data, which essentially validates the proposition that remote patient monitoring is going to be able to contribute to long-term care, We anticipate much more interest in the payers. We're obviously already providing bidders to those. And this is just a slide that shows our market traction. And so, yes, we have, quite a few sort of community practices. And then we've also been working with, academic centers in our studies. We have over $4 million in grants that we've even just put in the last 3 months. And so our platform is very popular with academic institutions, but we can also submit grants as our own institution as Play It Health, where we're considered one qualified for submitting R01s. We have a very experienced team. Every member on our team has over 25 years of experience in either health or in IT. And this is just a sampling of the clinicians that are on our remote care docs team. These are all very experienced clinicians that are well versed in each of their specialty areas, that have devoted time to understanding how remote patient monitoring works and can provide support to clinicians as they onboard.
Would love if you could share a little bit with us about, where you see Play It Health going in the future. I know you've spent quite a bit of time evaluating different market segments and channels, since there's a number of opportunities for you all. Where do you see the company over the next 3 years?
So I see this year us continuing to focus in the ACOs and the community practices, because that's an area that still needs quite a bit of help onboarding in RPM. And they're actually starting to circle back to us now with platforms they onboarded with during last year and are unhappy with the results, either with the long-term adherence or how patients are using that. I also see that the traction that we were already getting with payers becoming stronger now with the long-term data that we're getting. So within 3 years, I see us as being a leader in remote patient monitoring in community practices, hospitals, and with payers, but also being one of those companies that literally defines the paradigms for how remote patient care can be used and be effective.
That's awesome. So I know you've got a really interesting background personally. You've run hospital divisions, translational research committees for international organizations. How did the pandemic surprise you? What did you learn, and that you've been incorporating in your approach to running your company?
I think one of the biggest things that one needs to realize is that obviously as a clinician, the first thing you want to do is you want to help. And I've just learned more about the groups that we could help at the position that we were in when the pandemic started. And I think you need to be very focused in reaching out to those groups and better defining that scenario. I don't think the whole country really knew where to reach in this pandemic, and I think we'll be better prepared in the future. And I think what we also realized is that the very things that we're doing this year to move our company along will make us be in a much better position to reach out to all segments of the market should another one of these events come up, or should it be sort of, one way of thinking is that this is going to be sort of a common part of our landscape for a significant period of time in the future.